Good morning, everybody. It's my pleasure to be here. I want to thank the organizing committee for inviting me. So my disclaimer is that I'm not a physician and I'm not a nurse. In fact, I'm a social scientist and my background's in public health. And so in that sense, I'm kind of an outlier in this group. And I hope that what I have to say can contribute to our thinking differently and to pushing the boundaries of what we think about in terms of health and outcomes. I'm going to be working more on I'm going to be talking more about sort of what we've touched on in terms of the outer bounds of the community, the social aspect of health, instead of focusing much in the middle. All right, so again, when I thought about these two questions, I struggled. And the first question is, do doctors know best? And the short answer to that question is, in fact, there isn't a single person or organization or discipline that knows best. We indeed need each other. And in the solution to health, which is a very complex phenomenon, is complex. So if I'm trying to solve the issue of lung cancer, there's not much that I need to know about the lung if I'm trying to prevent smoking. What I need to know is communication, psychology, behavior change, politics, policy, economics. Those are things that are in the social sciences and not very often in medical or nursing or specifically health professional schools. So indeed, we need each other, especially in primary and secondary prevention, perhaps less in tertiary prevention. And we also need all of the stakeholders, including the community. And so I wanted to share this quote from a report called Walk Softly and Listen Carefully. And just that had me pause when I read it. And it's from a teleconference participant on how to build research relationships with tribal communities in the US. And this participant said, you have to be able to humble yourself before another person, to understand that each person has something valuable to contribute. So you have to be able to quiet down your own agenda and your own thought processes and open up your entire spirit. And I thought this concept of walking slowly and listening carefully was a very important concept in Who Knows Best. The second question was, who will take care of the world? And in fact, the very short answer to that question is every single one of us has to take care of the world. There isn't a particular group or person that has to take care of the world. And for that, I wanted to highlight Reverend Dr. Martin Luther King's statement, who said, all of us are caught in an inescapable network of mutuality, tied in a single garment of destiny. I can never be what I ought to be until you are what you ought to be, and you can never be what you ought to be until I am what I ought to be. And this is the interrelated structure of reality. So I could stop there with the short answers to those questions, but what I decided to do is actually reframe the question to what concepts help us as health professionals to be better equipped to do our part in improving conditions of daily living. And in a sense, I want to push the social accountability mission of all of our work. All right, so I had a revised presentation that didn't make it up here, but that's okay. So in thinking about this, I wanted to highlight what I feel is a definition of health, which is a WHO definition from 1948, which states that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. And that was 1948. Like 60 years ago almost, and it's taken us a long time to actually acknowledge that and work towards that. I also wanted to highlight that health for most people is seen as a resource for everyday living and not the objective of living. So although all of us that work in health feel like health is the thing, most people, if you ask them what their goals are in life, they don't say to be healthy. They want to be healthy to be able to do all those other things in life that are important to them. Now, in terms of guiding documents for thinking about what are the concepts that are important for us to know, I used three. One is the Institute of Medicine report from 2003 called Who Will Keep the Public Healthy? Educating Public Health Professionals for the 21st Century. The other is a report from the World Health Organization on Closing the Gap in a Generation, Action on the Social Determinants of Health by Michael Marmot et al. And the third is the document that has been spoken to already, the Julio Frank and Lincoln Chen et al. Document on health professionals for a new century. The first, the Who Will Keep the Public Healthy, really focused on ecological thinking and root causes. And it wasn't, of course, the first document to highlight this. But if you see this particular figure, it shows that the biobehavioral mechanisms and genetic makeup may be at the core of health, but indeed, unless we go way out to the external layers of this ecological model, we're not able to influence that core. So we need to be thinking about individual behavior, social, family, and community, living and working conditions, and macro-social and environmental conditions and politics over the lifespan. So that also adds a particular dimension to it. And so in fact, if you look at this, one could say that there is no single behavior that is fully volitional. And I know that that's a difficult concept to grasp, but nothing is fully volitional. Everything is impacted not only by what we know as individuals and what we do, but by our environments. So the document on educating public health professionals for the 21st century focused on the fact that action and research on complex health problems requires an ecological approach to problem solving, which then requires a well-educated interdisciplinary cadre of health professionals who know that successful interventions require understanding not only of the effects of behavior and biology, but also social, environmental, and economic contexts within populations exist, which all of a sudden gets us to outside of the healthcare system. So although part of the solution of health is in the health system, much of the solution to health is outside the health system, in education, in economics, in politics, in those types of ministries that we need to focus on. Health, indeed, is a social construct, not much a physical construct. I'm going to expand a little bit on this idea of social and community when I go to the Marmot report, the social determinants report. And this was, as I said, a report on the social determinants of health, closing the gap in a generation. And they define social determinants of health as the circumstances in which people are born, grow up, live, work, and age, as well as the systems that are put in place to deal with illness. And they did state that these circumstances, although maybe local or regional, are in fact shaped by a wider set of forces that are economic, social policies, and politics. And this is all about inequities. This report came out in 2000 and now I'm getting confused, 8, I think. I wanted to take social determinants for a minute and focus on them, because I think we use the word social determinants, we use the word inequities all the time, but I want to bring it down to what it means for people living in countries. So if you're a girl born in 2011 in Sierra Leone, Africa, you have a life expectancy of 47 years. If you're born in Japan that same year, you have a life expectancy of 86 years. How is that possible in our global world? How is that right? If you're pregnant in 2001 in Afghanistan, you have a 1 in 32 chance of dying during pregnancy and delivery. If you're pregnant in 2010 in Sweden, you have a 1 in 14,100 chance of dying during pregnancy and delivery. That is inequity. Those are the social determinants of health that we're speaking of. This has nothing to do with, it's where I was born. It's where I happen to be placed and work and live. And these are the things that health professionals need to be able to deal with. If you come sort of locally, we've done some work on the global burden of disease, looking at my area of research and interest as young people. We've looked at healthy life expectancy in our region. This is for 2010. There is 2013 data now, but we haven't been able to access it yet. So 2010 by income group. It takes the 21 countries of the Arab League and divides them up into lower income countries, middle income countries, high income countries, and looks at healthy life expectancy of 15 to 19-year-olds, 20 to 24-year-olds, and 25 to 29-year-olds. If you are an epidemiologist, and I think there are probably some in this is the type of graph that you would dream to see, because it just shows perfectly what you want to show. And what this shows is that for any of those age groups, at the age of 15 to 19, if you are living in a low-income country, you have a 10 years less of healthy life expectancy to expect than if you are living in an upper-income country in our region of the Arab world. The same with death rates. There's a 5-fold increase in death rate per 100,000 if you live in a lower-income country than in a higher-income country. So we're not talking older people, we're talking young people. And so the Commission on the Social Determinants of Health sort of concludes saying, this ends the debate decisively. Healthcare is an important determinant of health, lifestyles are important determinants of health, but in fact it's the factors in the social environment that determine access to health services and influence lifestyle choices in the first place. And they recommend the following actions: improve daily living conditions as a health outcome, tackle the inequitable distribution of money, power, and resources, and measure and understand the problem and assess the impact of action, and I've added, or inaction. Finally, I do want to take us to the most recent report called, which was the Education of Health Professionals for the 21st Century. And various parts of this report have been discussed, and the interesting thing is each of us that have discussed this report have chosen different pieces of it to highlight. And I think that absolutely shows the importance of all of us working together, because each of us will find different aspects of any report that we think are important. What I focused on a lot was the levels of learning that they brought up in the report. And I do recommend, as the speakers before me, that each of you, whoever hasn't read it, read it. It is not a bedtime reading. It's every single word and every single page of that report is heavy, but it's critically important to our work, I think, in health. So they define three levels of learning: informative, formative, and transformative. Informative being the knowledge base that we actually probably are most comfortable doing, all of us, but in fact is really, in this information technology world, the least needed. We need to be taking that out of the classroom. We don't need to be focusing on that in our classroom. Formative, which is what are the values that surround the work that we're doing, and how can those values be the values of social justice, equity, humanity, all those things that I think many of us have talked about. But probably the most important one is transformative, which is how do we create leaders that have attributes to become enlightened change agents and to actually produce change. And to focus on transformative learning, they suggest that it involves three fundamental shifts: from memorizing, which our region is we do that a lot. We just feed people information and they memorize. We do less of the analysis, synthesis, and I think we need to move into that. From seeking professional credentials to achieving core competencies, which have been talked about a lot today, and from non-critical adoption of educational models to creative adaptation of global resources to address local priorities, and that's been spoken a lot about today as well. And they do focus on the fact that interdependence and transdisciplinarity is key. Now, if you look up a definition of transdisciplinarity, it's different than interdisciplinarity, and it's different than multidisciplinarity. And transdisciplinarity is when, in fact, we are sharing conceptual models, so what's produced at the end is really a combination of everybody's models. You can no longer see medicine or nursing or public health or psychology or social science. It's one model that has come up from all of our dialogue together. And the report suggests that there are both instructional and institutional reforms that are needed to get us there, and indeed they've been spoken about a lot. I'm done in 1 minute. Okay, great. I did want to try to tie these strands together with just a few quotes from one last document that I think is important for all of you that work in health to read. And I think part of what I'm doing is pushing the envelope out towards the politics of health. Because as much as we want to focus locally and regionally and even internationally, there are forces taking place at the global level, global trade policies that influence local health, global health, like the GATS and the TRIPS agreements. All of those, probably health professionals say we have nothing to do with those, but in fact those types of agreements are really impacting health at a local level, and we need to be players at those global tables. So this was a recent Lancet Commission report on basically the politics of health. It's called The Political Origin of Health Inequity, Prospects for Change, and it's about global governance for health. And in the report, they state, we're challenged to develop a public health approach that responds to the globalized world. The present global health crisis is not primarily one of disease, and I think we saw that very much with the Ebola outbreak, but of governance. Construing socially and politically created inequities as problems of technocratic or medical management depoliticizes social and political ills and can pave the way for magic bullet solutions that often deal with symptoms rather than causes. The tremendous health inequities that exist are morally unacceptable and not in any sense a natural phenomenon, but the result of a toxic combination of poor social policies and programs, unfair economic arrangements, and bad politics. So my question is, what combination of educational experiences is needed to nurture ethical professionals with a passion for action, who are ready and willing to cross boundaries that restrict their profession, to tackle root causes, who can listen and reach out to communities and partners, and who can steward changes in health in their own community, in the region, and in the world. Thank you.